After atrial fibrillation, a surgeon gets back into rhythm. Atrial fibrillation can throw your heart and life out of rhythm, but medication is available to treat it. As a surgeon, Carol Scott Connor, MD, PhD, is used to dealing with patients, but when she had a bout of atrial fibrillation, she found herself on the other side of the exam table. Dr. Scott Connor, a breast surgeon and professor of surgical oncology and endocrine surgery, was at work at the University of Iowa Carver College of Medicine in Iowa City in 2007 when she sensed something wasn't right. "I was in the clinic seeing patients, and I was aware I was having a very irregular heartbeat," she says. "I was having trouble breathing. I went to one of the internal medicine clinics, and they shipped me off to the emergency room." In the Scott Connor had cardioversion, a procedure that uses low-level electrical shocks to return the heart to a normal rhythm. She was sent home with blood pressure medication and blood-thinning medicines. A few days later, the atrial fibrillation returned. She had another cardioversion and also had the doses of her blood pressure medications increased, but her AFib persisted. "I sort of settled into a situation where I would go into it around midnight while I was asleep," she says. "When I woke up, it would spontaneously go back to a normal rhythm." How she got atrial fibrillation under control, Scott Connor sought the help of a cardiologist, who had her keep a diary of her symptoms. He also added another drug to control the AFib. "He really just took a lot of time and a lot of care," Scott Connor says. "I would go into atrial fibrillation at night, so he had me take my medications in the evening instead of the morning. That way, the medications would hit a peak in my bloodstream at night." Most doctors opt for medication for atrial fibrillation over surgical treatment for their patients, at least at first. That means taking atrial fibrillation medication, known as antiarrhythmic drugs, because they help maintain a normal heart rhythm, says cardiologist T. Jared Bunch, MD, everyday health columnist and director of heart rhythm research at the Intermountain Medical Heart Institute in Murray, Utah. Atrial fibrillation is caused by abnormal electrical signals from the little veins that take blood from the lungs to the heart, Dr. Bunch says. They run into each other and create the abnormal rhythm. The medications slow down the electrical signs from those veins and make it more likely that the normal rhythm will go through. Related, 7 hidden dangers for people with atrial fibrillation. Medications typically used for atrial fibrillation may include rhythmol, propafenone, betabase, citalol, cordrone, nextrone, orpacerone, amiodarone, and multac, dronadrone. Which medication a doctor prescribes depends on the patient's condition. For example, betabase is often used in people who have other underlying health problems, like coronary artery disease or heart failure. For some mild cases of atrial fibrillation, antiarrhythmics can be skipped in favor of blood pressure-lowering medications like beta blockers or calcium channel blockers, Bunch says. Aggressive lifestyle changes greatly reduce AFib and may, in some cases, reverse it. Jared Bunch, MD tweet: Most people tolerate atrial fibrillation medication well, but some people who take such drugs end up having to stop because of bothersome side effects like fatigue, low heart rate, or changes in taste. When this happens, they can go on to another medication or have a procedure to help alleviate their atrial fibrillation, Bunch says. Scott Connor has done very well on her antiarrhythmic medication and never experienced significant side effects. Within about 2 months of beginning medication, her AFib stopped, and it hasn't returned. But the medication that worked for her won't necessarily work for everyone else, she stresses. It's more about finding a drug that works for you, and sticking with it, she says. A healthy lifestyle helps treat AFib. Today, Scott Connor takes no antiarrhythmic medication. She takes lisinopril, Preneval, Zestrel, a blood pressure-lowering medicine, as well as aspirin, a blood thinner. She also maintains healthy lifestyle habits, like getting plenty of sleep and exercising every day, practices that are just as important as medication for treating atrial fibrillation. Aggressive lifestyle changes greatly reduce AFib and may in some cases reverse it, Bunch says. Reducing stress, improving sleep patterns, treating sleep apnea, and changing your diet from one that's processed food-based to one that's more whole food-based, they're all important. Scott Connor also stresses the importance of being aware of the possibility of atrial fibrillation, because many people don't even know they have it. It's very important for people who are in their late 50s, early 60s, or older, particularly if they have high blood pressure or heart disease, to be aware it can happen, Scott Connor says. Catching it early and treating it could make the difference between having to have an ablation and just being able to be treated with medications and get over it. I think I was very fortunate.